Hello, my name is Kevin Mabry, and I've been a registered nurse for a little over 2 years now. I graduated from Delaware Technical and Community College in 2012, and I am in my last semester at Wilmington University for my BSN. This video is part of a project for my Nurse as a Leader course with the objective of promoting awareness of nursing as a profession and the future of nursing. The American Nurses Association defines nursing as nursing is the protection, promotion, and optimization of health and abilities, prevention of illness and injury, alleviation of suffering through the diagnosis and treatment of human response, and advocacy in the care of individuals, families, communities, and populations. In simple terms, we work solely for the patient and the family. The belief may be that we work for the doctor, following orders blindly, but the truth is we work for the patient, communicating his or her needs to the doctor, such as abnormal labs, uncontrolled pain, fears and concerns, and knowledge deficits. We act as the advocates for the patient when he or she may be too afraid to speak up, and we work to not only heal the patient back to his or her optimal level of health, but also work with the patient and the family through intensive education to help prevent or reduce future hospitalizations. Of course, we do not act as rogues within the field, as we have a specific code of ethics that guides our actions. The nursing ethical principles are autonomy, beneficence, non-maleficence, veracity, confidentiality, justice, and fidelity. A respect for our patient's autonomy means that we respect a patient's freedom of choice, and we help guide their choices through education and discussion. Beneficence means that our actions should be based on the best interests of the patient, as this is both morally and legally demanded in our profession. Non-maleficence relates to the principle of beneficence, in that we are obligated to do no harm to the patient. Veracity means to always be honest with our patients to ensure a continued trust in nurses and other healthcare professionals. Confidentiality means that we are not to share patient information with others who are not involved with the patient's care without the patient's documented permission. Justice means we must treat all patients fairly and to not discriminate against certain patients due to personal beliefs or fears. Finally, fidelity means that when we make a promise to a patient, we follow through with it within the best of our abilities. As nurses, we do not haphazardly act on gut feelings. Rather, we follow a nursing process which incorporates evidence-based practice and critical thinking to help solve patient problems. The nursing process has 5 steps: assess, diagnose, plan, implement, and evaluate. Assessments involve making observations, collecting relevant data, and interpreting it. Diagnosing involves identifying the problem based on the data collected from assessments. Planning involves hypothesizing and developing a course of action. Implementing is when a nurse takes action based off of his or her plan. And finally, evaluation means evaluating the effectiveness of the intervention and determining if your hypothesis was correct. Becoming a nurse can be a long and stressful path and requires an intensive amount of time and commitment in order to obtain the most out of your education. Colleges vary, as some offer associate's degree nursing, which incorporates approximately 2 years of prerequisite courses on various sciences and math, and then 2 years of nursing clinicals. Other colleges offer 4-year programs so the nurse may graduate with a bachelor's degree in nursing. The actual process of being selected for the clinical portion of nursing varies as well. Some have a waiting list where you must meet all prerequisites and then simply wait for your turn to be selected for clinicals. Other schools have a ranking system based off of your grades on your prerequisite courses, under the belief that those who scored higher are more likely to succeed during the clinical portions of nursing school. Nurses also become certified in basic life support for adults and children, and depending on what practice of nursing the person goes into, the nurse may also become certified in advanced cardiac life support. Nurses may also become certified in a specialized field of nursing, such as psychiatric and mental health nursing, forensic nursing, and pain management nursing. This usually requires at least 2 years of experience in that specific field. Nurses may also obtain their master's and doctorate in nursing, which only further opens doorways to the potential of a nurse to grow in his or her career. Upon graduation, many nurses go into the medical surgical field as it is considered the core of nursing practice and helps to enforce the core fundamentals of nursing. Other options beyond the medical surgical field exist, of course, including maternity, geriatrics, oncology, psychiatric care, intensive care, emergency departments, and operating rooms. As a nurse's education advances, so too does his or her options. A nurse with a BSN may become a case manager or an adjunct clinical instructor, and a nurse with an MSN may go into management, nurse education, or he or she can become a nurse practitioner under the supervision of a medical or psychiatric doctor. Nurse.com offers a greater in-depth exploration of the many options nurses have for their nursing careers. A nurse's income depends on several factors, including their nursing degree, specific field, years of experience, location, and the type of work completed. Between 2014 and 2015, the median salary for a registered nurse in the U.S. was between $65,000 to $66,000 per year. Nurses with advanced degrees saw significant increases in income. Certified nurse anesthetists earning $148,000 yearly, and nurse practitioners earning nearly $90,000 per year. It is important to point out, though, that potential nurses should not choose the profession of nursing solely for the money. It is important for nurses to be compensated for their skills and education, but the nurse's main focus should be on the high quality and safe care of the patient. The demand for more nurses is only going to increase due to an increase in the amount of nurses retiring and an increase in the numbers of the aging population who will require intensive care for their chronic medical issues and comorbidities. To help with this issue, the Institute of Medicine is proposing solutions that may affect the future of nursing practice. This can include removing the scope of practice barriers on advanced registered nurses so they can have increased freedom to practice without doctor supervision based on their education. The IOM also wishes for there to be an increase in nurse residency programs to assist entry-level nurses find employment and begin their practice. They would also like to increase the percentage of nurses who have a BSN to 80% by 2020, as this is statistically proven to reduce incidences of errors with an increase in quality patient outcomes and satisfaction. The IOM would also like for there to be an increase in nurses involved with changes that occur in healthcare through their involvement in nursing politics. The nursing career is both a challenging and rewarding field for people to provide compassionate care to people in vulnerable states. The path to becoming a nurse can be difficult and requires years of commitment. However, to know that each day you are making a difference in people's lives makes it all the more rewarding. It is a career with a lot of options for growth and potential, and it will only continue to grow as a profession. Thank you for taking the time to view this video, and for more information on nursing, please visit the American Nurses Association website at nurse.com for more information.